Good morning. This is Dana Parsons with LeadingAge Virginia, and welcome to the coronavirus uh, weekly call. We are waiting for our speakers to join us, so I did want to make a couple of announcements. Our General Assembly special session recently ended, and LeadingAge Virginia has a webinar. It's about 20 minutes that you can share with your staff. We'll be having that in our update next week. This particular update is going to be providing an update on the key legislation that passed impacting aging services. There were quite a few bills that were introduced during the special session, but about four to five of them, key bills, were the only ones that passed. So we'll be providing an update on that, and that way you can share the link with any of your staff. I'm also happy to do a virtual presentation for you or your staff at any time. Just let me know. I see Dr. Rossheim has joined us, so we are going to move over to that discussion. So thank you, Dr. Rossheim, for joining us. Can you hear us? If you are on the phone, you may need to *6 to unmute.
Can you hear me now?
Yes, yes.
Okay.
Okay,
Well, thank you.
Yes, thank you for joining us. We're going to move to our slide that talks about testing. Can you see the slides, Dr. Rossheim?
Yes.
Okay, great. Thank you. Over to you.
Okay. So basically, pretty briefly, just wanted to let everyone know that we have from grant funding, there was $16 million allocated for testing, and we recently made a purchase of about $7 million ish to obtain 7 of the BD, the Becton Dickinson Veritor analyzer machines, and about 240,000 tests. So we have about roughly about $8.5 million left, that we want to use for to purchase more testing supplies. And so really the simple ask is that I'm going to put together when I can get a kind of a free minute, I'm going to put together a brief survey, just asking people, how they like the BD Veritor, how they like the Abbott Binax Now cards, what would they like to see us purchase with the remaining funding. The purchase order needs to be submitted, in early December. We're working with a multi-state collaborative group on this. So that's really the main goal of all this, is just to see, for the next purchase, what would people like to see us get. Now, I can't guarantee that all of these tests would be going to long-term care, but I believe some of them would.
And these would not be at any cost to the communities, is that correct?
That's correct. The tests would all be free.
And do you foresee any of these testing going to assisted living as well as nursing homes?
Probably, yeah. It's, again, it's a little early for me to say, because we've got Abbott Binax Now. I mean, we know that the federal government is also shipping Abbott Binax Now cards to livings as well. So it really depends upon the need for where these things are going. But I believe, I mean, we know that there's a need for nursing homes and for assisted living.
Well, Dr. Rossheim, I have put in the chat box, just to give you an idea. I know we're going to be working on this survey and getting it out to our members, but I just
Hmm.
asked if the members could put in the chat box if they had the opportunity to make the choice about how the agency would spend the money, what testing would they prefer. So far, I have Binax is the first response. I wanted to ask the membership if there had any questions about those, your reference to the to HHS sending out the Abbott um, cards. Is there anyone who has any questions about that? And by the way, Dr. Rossheim, Binax is coming in. That seems to be, yeah, that so far, if you are able to see the chat box, is the response from everyone.
Let's see. I see. Can y'all hear me? Okay.
Yeah, we can hear you absolutely.
Okay. So what I see so far is uh, Binax, Binax, Binax. Um, okay, so I see about 4, 5. Um, okay. Yeah, basically, um, what I'll do is the plan is to send the survey out to the nursing homes and assisted livings. Um, since both of those groups are heavy users of testing, and that way it would give us a more informed opinion about more informed more data about what people really want.
Oh, absolutely. And so we'll be sharing the survey with our membership as well. I just wanted to give the opportunity to weigh in so you could have some idea. So a question has come in, who do we contact if we have not received any cards yet?
Um, if you have not received any cards, the we set up an email box. Uh, the email. Well, actually, let me hold off on that for now. The person to contact would be Linda Anthony.
And do you have Linda's contact information?
Yeah,
An email address? Yeah, if you could put it in the chat box, that would be great.
I'm gonna type it in the chat log now. So
Okay. Thank you. And another comment, antigen testing in general is less accurate than PCR testing. Negative results in persons under suspicion should still be followed up with PCR testing. So thank you, Dr. Wright. Okay,
uh,
great. Thank you. We see that Linda's email address.
yeah, yes. True that antigen testing in let me pull that comment up. I just want to make sure I antigen testing in general is less accurate than PCR testing. Negative results in persons under suspicion. Yes, if you have a person, it's true that antigen testing is somewhat less sensitive than PCR testing or molecular testing. Um, and if you have someone who is symptomatic, uh, who has a negative antigen test, then our recommendation is to follow that up with is to isolate that person, right away, follow that up with a PCR test, and then see what the PCR results are. We have a guidance document on the health if you go to the health professional section on the VDH external website, the COVID-19 website, you will see the document. I can put a link to the document in the chat if people want it.
Yeah, that would be great. Thank you so much, Dr. Reisheim. We appreciate that.
Thank you, Dr.
Sure.
Reisheim. This is Jim Wright. I put the comment up there. I just wanted to make sure we were all aware of the limitations of the antigen testing. We typically don't use them much at my facilities. We prefer to use the PCR testing, but we're fortunate.
Yeah, I mean, you know, I'm sorry.
We're fortunate enough to have access to PCR testing with rapid turnaround time. So I know it's different for other facilities.
Yeah, I mean, you know, one of the things, you know, this is an ongoing conversation, you know, regarding, you know, the benefits of PCR versus antigen testing. One of the things about antigen testing is that, you know, if you're in a situation where, you know, you're testing people, you know, regularly, serially with antigen testing. So if you're testing them, you know, twice a week, it's certainly been proposed that if you're doing serial testing on the same people with antigen testing, that even a lower sensitivity test like an antigen test may get the job done because you're doing serial testing on the same people. That data comes more from modeling data, but you know, different, like you said, different places have, you know, some have the capacity to do PCR testing, some do not. And the other thing is that when you look at the CMS document from, I believe it was late August, CMS does not specify that it has to be, you know, one or the other, molecular or antigen.
Well, Dr. Reisheim, thank you so much. I'm sorry we're so limited on time today, and I apologize for interjecting, but I just wanted to make sure we were able to get over to Sarah Lineberger and Mike. Were there any other last comments that you wanted to share?
No, I just need to put the survey together, so I need just a little bit of time just to kind of put that down on paper and send that out to you know, the long-term care task force, and so that way it'll get to the nursing homes and you all, and that way you can send it to your membership, and they can send it to their membership, and it would, you know, in that way we can get a, you know, pretty, you know, we can get some idea of what people are, you know, a quantitative idea of what people are thinking.
Okay, great. Well, thank you so much. Hope you can stay on with us if you have time, just in case any other questions come up. But I see that Sarah has joined us, so thank you so much. Over to you, Sarah.
Yeah, I'll be on the call.
Okay, great. Thank you.
Hi, Dana, can you hear me?
Yes, we can hear you. Thanks for being on.
Sure. So I think you wanted me to talk about visitation and holidays. Is that correct?
Yes, and any other updates you have? I know that the governor recently had some executive orders about some additional limitations, and some questions have come up about that, so they may come up on the phone today, and if we don't all have the answers, then we can certainly get back to the members on that. But I know some questions have come up, if you're able to help navigate those.
Sure. I'm happy to take questions on the executive orders that went into effect a couple days ago. I likely don't have the answers, but I'm happy to take questions and get back to folks on that. I just put the link for the Long-Term Care Task Force website in the chat. Again, that we try to make that sort of a one-stop place for information. And I know Mike is going to talk about vaccination here in a minute. The 2 vaccine webinars we've held that have included the long-term care population, both of those are under training resources on the task force page. So we continue to try to put stuff there that's relevant. So if you weren't able to listen into those, you should be able to get to those recordings. If you have any trouble, just let me know. So we did issue, LeadingAge issued some guidance for holiday considerations for residents and their families. And I'm sure that Dana has sent that out. I'll put the link in the chat.
I've got the link at Sarah. I can put it in right now. Yeah, and it is also in all of our updates that just went out.
Awesome. So we're hoping this 2-page resource could just be shared directly with residents and or their families for them to be able to think through this. From the LeadingAge perspective, we certainly don't want to tell residents and their families that they can't celebrate the holidays together. We understand that this is a really complex thing to work through with the upcoming holidays, but we heard from providers it would be helpful to put something on paper. So this guidance document has things to consider that families and residents can consider. And we know you all have been doing a lot of planning around Thanksgiving, and I appreciate that. And I'm happy to take questions. This guidance document essentially gets to the fact that, you know, having family members come into the facility to celebrate with their loved one is likely a lower risk situation than a resident leaving for a period of time and coming back. We know some facilities are putting into place protocols if a resident does leave and come back. Many facilities are thinking about a 2-week quarantine period if a resident comes back, and or doing testing. Neither of those are requirements. We were expecting CMS to put something out, but I still haven't seen anything, and I know Thanksgiving's next week. So if CMS puts out something, I'm sure that you all will hear about it. CDC did update their holiday guidance last week and included considerations similar, sort of along these lines, and we linked the CDC guidance in the LeadingAge document, but I can also put the link for CDC guidance in the chat. And they said that among other people who should not attend in-person holiday gatherings, that would include anybody at increased risk for severe illness. So that's something to think about too. I'm happy to take questions or concerns, but that's what we have for holidays right now.
Are there any questions for Sarah about the holiday guidance? Okay, we do have a question. Sarah came into the chat room privately, actually. What do we do if a patient wants to be with a family but are in a semi-private room and the facility does not have a private room to isolate upon return?
I'm sorry, I missed part of that. So if a resident has a semi-private room and what?
I am going to, I'm not sure I'm understanding all of the question. If the person who sent that could clarify a little bit, and then I will ask that again. They want to go out overnight. What do we do if a patient wants to be with family but are in a semi-private room and the facility does not have a private room to isolate them upon return, wants to go out overnight?
Yeah, I mean, I think that's a really good question. Again, at the state level, we haven't put any requirements into place, but the inability for a resident to isolate upon their return, I think should be considered whether that's possible or not before a resident leaves. and if it just isn't possible in a facility, and I certainly understand all the challenges with not having private rooms and resident placement and all the movement that's happened, if there's not if a resident is not going to be able to isolate when they return, then I would think it would be a reason for the facility to consider not letting them leave. From what we understood, if CMS was going to put out guidance, they were going to differentiate leaving for a short amount of time, like a couple hours, versus leaving for more than 24 hours. But again, I haven't seen anything from CMS. So if they do put out guidance, it might be helpful with that situation. But again, not to put this all on facilities, but it's hard to write guidance for every facility situation since every facility is set up differently in terms of space. That has been very difficult to write guidance for cohorting and movement as well. But I think the facility needs to think through whether they can keep the other residents safe, and if not, then you might not be able to let the resident leave and come back. That's just me sort of talking through that with you all, but we don't have anything in VDH guidance per se that addresses that. I don't know if that helps.
Yeah, thank you. A comment came in, wouldn't you put both residents on quarantine? I know this is a really tough situation to resolve. Any other questions? Okay, Sarah, is it okay if I open it up at this time to talk about the governor's executive orders?
Sure.
Okay, I know there were some questions specific to adult day. So if any folks on the line want to chime in, anyone have questions? I did get some clarification from the health department regarding dining, and I can put that in the chat box. But there were some concerns about adult day regarding over 25 persons and requiring masks and some participants not being able to wear masks. So I would ask if any adult day folks are on and want to come off the mute and ask their questions.
Dana, this is Carla Groff. Can you hear me?
Yes, thank you, Carla.
Okay, I did have a couple questions. In the memo, we were sent a memo from Tara Ragland, the Director of Licensing with DSS, and in the memo, she was saying that we would be limited to 25 individuals, and that was a change from 250. And for example, I'm licensed for 50, and we have 2 great rooms. And social distancing wise, I know I can't have 25 per room, but if I were to have, say, like 15 in one room and 15 in the other, would I still be, are they looking at the entire facility, or are they looking at each great room, if we can isolate those people from each other? That was my first question.
This is Sarah. I believe that I did see that email this morning, and if you haven't heard from DSS yet, Dana, I can follow up with them and just try to get an answer. I don't have an answer right now, but I will follow up on that.
Thank you, Sarah. Yeah, I have not heard back from DSS yet. That memo went out late yesterday, so we are seeking some clarification on that.
Dana,
Yes.
it's Cindy Carneal-Heflin from DSS. I have sent that question up with a draft response, so you should be able to receive clarification on it fairly soon.
Okay, great. Thank you so much. We appreciate that. Are there any?
Cindy. I did have another question too, about the 25. Does the 25 just refer to the patients that we have in the building, or does that include staff? And then my other question was, we did have a waiver before for those individuals who could not mask for one reason or another, whether it be a health condition or a medical condition or a mental health condition. And the memo that we got from Ms. Ragland didn't really, it said that there was a exception for those people with a medical condition, but then the new requirement, it wasn't clear whether or not there would be that waiver there for those people now.
Carla, it's Cindy again.
Yes.
The memo says
Yes.
with noted medical exceptions. Those exceptions are noted in the governor's executive order, and I can send you a copy if you need it.
Okay, great. Thank you very much.
Yeah, they are very specific, and so it's not actually a waiver. It's the governor's executive order does have exceptions for those types of circumstances that you were talking about, and I'll send you that.
Okay, thank you so much.
Okay, thank you, Cindy. I wanted to see if there were any other questions while we have Sarah on. Okay, Sarah, well, I hope you can stay on as we move over to Mike Magner's update with the Department of Health, in case any questions arise.
Sure.
Thank you. Okay, Mike, thank you so much for being on with us today to give us some additional updates regarding vaccines. So over to you. Thanks so much. And you may need to *6 to unmute.
Can you hear me now?
Yes, we can hear you. Thank you.
Okay. All right. So I can't see the screen because I never connected, but are you showing the slides that I sent you?
Yes, we're on the Pfizer vaccine update.
Okay. So the breaking news last week was that Pfizer announced that they had enough clinical trials data to show that the vaccine was at least greater than 90% efficacious. And actually, there was a follow-up press release today showing that it's greater than 95% after completing their first study endpoint. They are planning to submit an EUA by the end of this week. As of today's press release, it said, within days. So that's what we're kind of looking forward to. So that's really good news. There are some caveats. Again, we've seen the preliminary results, but the underlying data was not included in the press release for obvious reasons. That's going to be submitted to the FDA with all of their data that they have. And, for all of these vaccines, there's no way we could know how long that protection lasts, right? So the only way to know that is to study it for months and months after the second dose, and we're just not there yet in terms of time. However, it does show that after the second dose, which the two doses are taken 21 days apart, so about 7 days after the second dose or 28 days into the study, they have really good protection from the vaccine. Safety data also looks really good for Pfizer. Very, minor issues in terms of side effects directly after the second dose. Headaches and pain at the site of injection are the primary ones. And even then, it was only about 2% of the study participants, at least according to their press release. Again, not seeing all of the data makes it a little hard to evaluate their claims. If you go to the next slide, so the next steps, as I mentioned, the EUA application is expected. And then once the FDA gets the research data and the study paper in the application, they're going to take about 1 to 2 weeks, probably. Could be longer, but it really depends on how fast the FDA works to make their decision. If they go with an emergency use authorization, that approval process is a little different than the full licensure. So emergency use may restrict the use of the vaccine for certain population groups. So we're really not sure how that will come out in the wash. After the FDA's decision, the Advisory Committee on Immunization Practices, or ACIP, will then make their recommendation as to who actually should get the vaccine based on the data. They may advise that certain groups that weren't included in the study not get vaccinated at this time until more research is available. And then they will also determine what the priority groups are in terms of which order should we vaccinate people in. And then Virginia has a vaccine advisory work group, and within that work group there is a sub-work group called the efficacy sub-work group. That group will actually do another review, an independent review of the data before making a decision for Virginia, or at least a recommendation. So several different independent reviews will be done of the vaccine, in addition to the federal government review. So we're pretty confident that if we get, recommendations from all those different sources that this is a good vaccine to give out, then, we will start to vaccinate as soon as those doses become available. I mentioned the Pfizer vaccine. Moderna just put out a press release yesterday, and I didn't even have time to update these slides, or maybe it was 2 days ago, but their vaccine uses very similar technology to the Pfizer vaccine, but it's given at 28 days apart, very similar efficacy, very similar safety, so I think that'll give us two different vaccines to work with. If you go to my third slide, I talked previously about the long-term care facility pharmacy partnership with CDC for vaccinating assisted living facilities and skilled nursing facilities primarily, although other types of assisted living and long-term care facilities were allowed to sign up. They weren't guaranteed, but the process is that CDC has contracted with CVS and Walgreens pharmacies to vaccinate the residents of long-term care facilities, specifically looking at facilities whose residents are primarily 65 years of age and older. That does not mean that while they're there they won't vaccinate someone who's 64 years old, but that's pretty much what they're looking to do, and this will be during the Phase 1B part of the campaign. And then the pharmacies will contact the included facilities directly and schedule the vaccination events for them. The pharmacies will be responsible for complete end-to-end management, and that they will receive and store the vaccine, schedule the administration appointment, come to the facility on site, and actually administer all of the vaccines. And then they will enter all of the doses provided into the information systems required by the CDC. Then they'll schedule the follow-up events, and they'll come out to the facility up to 3 times. So first, day 1 to vaccinate everybody with the first dose, and then 3 to 4 weeks later, depending on which vaccine they're using, they'll come out and do the second dose, and then they'll come out again another 3 to 4 weeks later and do the third dose. And so, it's really the second dose for anybody who hasn't gotten their second dose yet. So, for instance, on the second visit, some of the people they vaccinate may be getting their first dose, and so by the third visit, they should be able to get pretty much everybody at the facility.
Mike, a question
again,
I'm sorry,
yes,
Ted. Is this a good time to ask you a question?
Go ahead.
A question came in the chat box. Would this also include independent living residents who are part of a long-term care campus?
That is probably going to happen. Again, that's something that when the pharmacy calls, I would have that conversation with them and just make sure that they're planning to include that facility. I know that was CDC's intent, but I think it's, everything that we have been working with CDC, it's subject to change, obviously, and it's their program. But I would assume that we would want to go ahead and get them included. I think there would be incentive for the pharmacy to do that because they get, paid through the contract based on how many doses they administer. So there certainly would be ample incentive for them to do that. But I can't guarantee that at this time.
Okay, but just to recap, so if you have independent living and maybe senior affordable housing, also when they reach out, just call them and discuss that to see if you could move forward with that level of care. Because I know independent living was included on Red Cap for those numbers, projected numbers.
Yeah, and let me just clarify, because those facilities were allowed to go into Red Cap and enter their request, and CDC did encourage them to go in and sign up. However, when they got the final list back, the message they got was they gave back to the states was that they cannot guarantee that every facility that entered an entry into Red Cap will necessarily be included, and that they are going to prioritize the skilled nursing facilities and assisted living facilities, and then other facilities that are that are entered into there. It's going to be dependent on what kind of facilities they are and the age of their population and whether they fit into that phase 1B prioritization. So it's kind of like, at first they encourage everybody to sign up, but then later they say, well, we can't guarantee that we're going to include everybody. So hopefully that answered the question.
Yes, thank you.
Okay. And then
I'm sorry, we have another question that came in, but we can wait after your last slide.
Yeah, the last slide just talks about the fact that, when we got the list from CDC right before the sign-up closed, we saw that there were a number of facilities that had not gone in and entered their choice. So we made a decision to go ahead and opt them in, and we just basically put together a spreadsheet with all the facilities and points of contact and addresses and sent them directly to HHS. And so we opted in all of the skilled nursing facilities and assisted living facilities, even if they didn't opt in. Now, this doesn't mean that they're obligated. They can always decline the service when the pharmacy reaches out and asks to come in and do the immunizations. They could decline the service then, but if they weren't included initially, then they wouldn't be included at all. And so that's what we wanted to avoid. So that's pretty much it for my presentation. I can take any other questions.
Yes, thank you. And we really appreciate the agency moving forward with submitting all of the nursing homes and assisted livings for the vaccine. We do have a question. If we have an admission after the pharmacy has made their third visit and that admission has not received the vaccine, how are we to go about getting them vaccinated? Will all admissions to the hospital be offered the vaccine prior to be admitting to a nursing home? In this case, we administer the flu shots to new admissions that have yet to receive it, but the storage requirements around the COVID vaccine would be difficult to manage.
Yeah, so as far as I know, there's only a plan for them to come out 3 times. I'm not sure if there's going to be an opportunity for a 4th follow-up visit or future follow-up visits. I know that you're going to have kind of a moving registry of folks that are coming into the facility over time, and you're going to want to have them vaccinated. I think the plan is that by that stage in time, that vaccine will be a lot more available through all the pharmacy partners and through different physician provider groups. And the other thing you can do is, if you have your own capability to enroll in the program, to fill out the provider agreement to become a vaccine provider. That way you can get vaccines delivered directly to your facility and then use those to vaccinate people as their new emissions come in. As far as the vaccine storage requirements, there are a couple of things that I can offer. First of all, the Moderna vaccine, which is available in smaller dose increments of 100 doses, only needs to be stored at -20, and it can be stored in the refrigerator for, right now they're saying 7 days, but they're submitting data to FDA showing that it's actually stable at refrigeration temperature for up to 30 days. So if you don't have the ultra-low cold storage capability, there will be the opportunity at that future time to order one of the other vaccines that doesn't require it. Another thing is the shipping containers for the Pfizer vaccine are designed to allow you to store the vaccine for up to 10 to 15 days, depending on which piece of information I read. As long as you replenish it with dry ice every 5 days, you can actually store it in the shipping container for about 10 to 15 days. And then after you thaw it, it's refrigeration temperature stable for a couple days after that as well. So that's pretty much the plan going forward. Any questions on that?
Yes, regarding the provider intent form that you mentioned for those that might want to continue, should they go ahead and complete the provider intent form in the event that that's the case? And if so, would that in any way cause any confusion about them registering for the pharmacy program? And then one other question, will they still need to document in this for the vaccines, for the Virginia immunization system?
So yes, they can sign up as providers with the provider intent form with the state. That will not preclude them from participating in the CDC program. It's probably a good thing to do because, like I said, the CDC program will probably vaccinate most of their residents and staff, but there will still be, other folks who were not present on that day or, came in after that day. And so it will be very beneficial to be able to sign up as a provider to go ahead and immunize those personnel. Any vaccine that the facility provides as a provider will need to get documented in the VIS system. And, so if a facility is not connected to VIS, that'll be part of the process and enrollment is to get set up so that you can provide your vaccine doses information into VIS. Over.
Okay, thank you. I was trying to access the provider intent form and I was having some trouble, but I will get that information into the chat box. There was a comment from Dr. Rossheim. Mike, first, it is known that we do not know final data on the Moderna vaccine. Having said that, given that the Moderna product does not have the same stringent temperature controls as the Pfizer product, is there any preference being expressed for the Moderna product over this Pfizer vaccine? Also, some facilities simply may not have the capability for ultra cold storage.
Okay, yeah, and I think I addressed the ultra cold storage in answer to a previous question, but right now the issue is that the Pfizer vaccine is going to be out first, and for the first however many weeks of the vaccine campaign, it's going to be the only product in town. But then once the Moderna vaccine becomes available, we will look at what capabilities a facility has and what their preference is and try to match them up. But, for the first few weeks, the Pfizer, not only are they closer to getting the EUA authorization, but they're also projecting about 50 million doses by the end of the year, whereas Moderna is only projecting about 10 million doses. But as we get into like phase 2, there'll probably be even more vaccines than that. And if people have specific vaccine preferences, we'll work with them to get them ordered the vaccine that they want. Over.
Thank you. Are there any other questions for Mike? Well, thank you so much, Mike, for being on. We really appreciate it. We are going to move into our final topic for today, which is the Project ECHO. In addition to VCU, George Mason is now participating in the program and wants to talk a little bit about that and how nursing homes can participate. So over to you, Emily.
Thank you, Dana. Hi, everyone. My name is Emily Ihara from George Mason. And as she said, we have a training center in addition to VCUs. I know that VCUs is full. So we're just asking for help getting the word out. There are 278 Medicare and Medicaid certified nursing homes in Virginia, and I don't think we are close to getting to all of them. And we really want to be able to provide this community for everyone, because these are tough times. Can we go to the next slide? So I think that, well, most of you have probably heard about this. It is a project that is funded by the Agency for Healthcare Research and Quality, and they're getting in collaboration with the Institute for Healthcare Improvement. So the curriculum is very timely and up to date. We have IHI experts on every meeting, and we're running it. The George Mason times are Tuesday and Thursday, and if we have additional interest, we may be able to add another time. But really the idea is to build this interactive virtual community of practice and mentorship to help nursing homes, the staff from these places, whether they're the administrators or the nurse practitioners or infection preventionists, social workers. And we've had a range of folks join our calls, and it's been really interesting so far. The motto is all teach, all learn, and really to have both experts on the call, but also for folks to offer guidance and support for each other. We just had a really interesting discussion yesterday, kind of similar to what you all are talking about in terms of the holidays, and how folks are, how the facilities are going to manage that. And there were different ideas that were thrown out about that. And it was really actually quite moving, I thought. Next slide, please. Some of the curriculum highlights are things that I'm sure that most nursing homes are already updated on, but it's an opportunity to just discuss the latest VDH and the CDC guidelines in terms of PPE best practices, infection control practices, COVID-19 testing, the management of asymptomatic and mild cases, and minimizing the spread, and then definitely in terms of dealing with the social isolation piece of this. Next slide. And so there are certainly lots of benefits, and the $6,000 is hopefully an incentive for nursing homes to participate. If they qualified for provider relief funds, then they're eligible to receive that $6,000. There's a few attendance requirements, right? Like they have to send at least 2 staff to attend regularly and attend 13 out of the 16 sessions. So we are continuing to register people. We are on week 2. So if you or anyone you know is interested in joining, ideally they would join tomorrow so they wouldn't miss week 2. And that gives them a little more wiggle room in terms of missing a couple more throughout the 16 weeks. Next slide. So that's our website, and on that website there is a link to the interest form, and then we will send out the information regarding you know, the specific cohort time and registration information. And my email is on the slide. If anyone has any questions, I'm happy to answer them now as well. But I just want to put a little plug in, because I think that with all of the information and the crises that have that have been happening, it was as a reflection of yesterday's session, it was just really a nice opportunity for folks to share what they have been doing, kind of some of the issues that they're encountering, questions they have to ask, and there was a lot of great information sharing. So I would encourage anyone who's not already signed up to sign up, and we can work with you in terms of other questions that you have.
So thank you, Emily. Just to clarify, if you've signed up for the VCU program, you would not be eligible to sign up for yours. You can only sign up for one or the other.
Correct. Yes. There are only 2 hubs in Virginia, VCUs and Masons. So yes, you can only sign up for one.
Okay, great. Well, thank you. If there are there any questions for Emily, you can put those in the chat box. And so I will keep an eye on the chat box to see if there are any questions. As we near the end of the call, I wanted to mention that there will not be a call for next week to honor Thanksgiving. We have put in the chat box the LeadingAge member solutions, which are a result of surveys from LeadingAge members all over the country about how they are moving forward with the Thanksgiving holiday. Yes, we have a question regarding Project Echo. Is this nursing homes only, not assisted living? I understand that assisted living are not eligible. Is that correct?
That is correct. However, I mean, we are allowed a little bit of leeway, so
Okay.
we can't
Sure.
do all assisted livings, but certainly if folks are interested, George Mason's focus is really to try to help folks manage all of this. So please go ahead and register.
Okay, great. So an assisted living that you could work with, would they be eligible for the $6,000 for
Oh,
participating?
unfortunately, no, they're not eligible for that part. They would just be able to come basically and join our sessions.
Okay.
The 6,000 is a federal, it's handled by the feds basically. So they are determining the eligibility.
Okay. Okay, well, thank you. I'm not seeing any more questions in the chat box. Thank you, Emily, so much for that. If you have any questions for her, you can send them to the email there on the slide. Again, just always know your LeadingAge Virginia staff is here to answer any questions that you have. Hope that everyone has a wonderful Thanksgiving, and we will look forward to talking with you again at 11 o'clock on Wednesday, December 2nd. Thank you, everyone. Have a great rest of your week.